The Verisyse phakic intraocular lens, or IOL, is a micro lens placed behind the cornea inside your eye. The word phakic means that your natural crystalline lens is left in the eye. This is important because your natural lens plays a vital role in helping your eye adjust between seeing objects that are near and far. The Verisyse phakic IOL design has been successfully used in Europe for 18 years. More than 150,000 phakic procedures have been performed worldwide. In the United States, clinical studies of the Verisyse procedure began in 1997. It was FDA approved in 2004 after these clinical studies proved that Verisyse is a safe and effective way to reduce your need for thick glasses or contact lenses.
What I will tell people that are in my same situation is that I was so disappointed every single time I visited any other doctor's office because of the fact that they couldn't really do anything for me. With this new implant, it was so amazing the way that you can see now. You can read small print, large print, you can see at a distance. It gives you so much freedom to do whatever you need to do.
I was interested in doing LASIK, and it was actually an extremely important thing for me to do now before I ever had children, because my vision is so poor, and I didn't want to have to be a mom always trying to reach for my glasses or having my contacts in, because I am so blind. There's no way I can really function without having my glasses or contacts. As it turns out, I was not a candidate for LASIK. I'm one of those out of 1,000 people who can't have LASIK because my cornea was too thin.
I think what definitely bothered me about having bad eyesight, besides the fact that I had it for so long, was not being able to just see in the morning, to be able to go swimming and see, to do sports and not worry about if I was wearing my glasses that something would hit me in the face and I'd break my glasses, or if I had my contacts in that I'd rip them, and then I'd have to carry around like 20,000 spare pairs.
If you are very nearsighted, are tired of depending on contact lenses or thick glasses, and are at least 21 years of age, you may be a candidate for the Verisyse phakic IOL. Your doctor will perform a series of tests and discuss options with you to help you decide if you meet the following criteria for having a Verisyse procedure. Your eyes are healthy, with no eye disease, iris or corneal abnormality, or history of retinal detachments. Your nearsightedness can be corrected with lenses between -5 to -20 diopters. You have 2.5 diopters or less of astigmatism. Your eyes are stable, and your nearsightedness has not changed more than 0.5 diopters for 6 months prior to surgery. You are not currently pregnant or nursing. There is not another vision correction procedure that provides a better alternative for your visual condition. As with any surgical procedure, there are risks, including temporary or permanent vision loss. Your doctor will explain these risks to you and ensure that you understand them completely. Verisyse is a micro lens developed to correct moderate to severe myopia, the medical term for nearsightedness. The procedure involves placing the Verisyse phakic IOL behind the cornea in your eye. This gives your eye another focusing lens that provides high-quality, high-contrast vision like a normal eye. Although the Verisyse lens is intended to be permanent, it is reversible if needed.
I can actually wake up, not have to wear contacts or glasses, and go to work and function like everyone else. It's really amazing. And when it was all said and done, I sat up from the table and walked out of the room feeling fine. But after only a few seconds, I was able to see.
During preparation, they talked about what they were going to be doing, that I was not going to be under total anesthesia. It was going to be local. After surgery, they gave me some pills that I can take just in case there was discomfort, but I never even got to take them. The procedure was done so quickly.
Implanting the Verisyse phakic IOL is an outpatient treatment, and the procedure takes about 15 to 30 minutes. Usually, only one eye is treated at a time. During the procedure, drops will be placed in your eyes in order to reduce the pupil size. For better access to your eye, your doctor will use an instrument to comfortably hold your eyelids open during the procedure. A local anesthetic is given to sedate the eye, so the procedure is virtually painless. The small incision is made in the cornea for the Verisyse lens to be placed in the space between the iris and the cornea. The Verisyse IOL is centered in front of the pupil, the black part in the center of your eye, and is gently attached to the iris, the colored part of your eye, to hold the lens in place. The small incision is closed with microscopic stitches that dissolve on their own. A temporary shield will be placed over your eye to protect it during the time just after the procedure. Verisyse implantation is a virtually painless outpatient procedure. The Verisyse lens is placed inside the eye between the iris and the cornea, providing another focusing lens that offers high-quality, high-contrast vision. The Verisyse lens is centered in front of the pupil and gently attached to the iris to keep the lens secure. Verisyse is specifically designed to provide precise vision correction for very nearsighted people who are not candidates for custom LASIK. LASIK is an excellent procedure for people with lower levels of nearsightedness. Most people who have the Verisyse procedure see well up close and at a distance because their natural lens is left in place. This lens, the crystalline lens, naturally adjusts to focus on near and distant objects. As you age, this natural lens function may diminish, and you may need reading glasses to see objects that are near. The Verisyse lens is removable. If in the future your doctor determines that there is a better procedure, you can have that procedure. Once implanted, the Verisyse lens will not slip or fall out. The lens is extremely secure because it is carefully attached to your iris inside your eye. You can swim and participate in virtually any other activity with the Verisyse lens because, unlike contact lenses, the Verisyse lens is placed behind the cornea of your eye. Therefore, it is not affected by external elements such as water. The Verisyse lens is not affected by external elements like rain or steam because it is placed behind your cornea inside your eye. The Verisyse lens can be surgically removed at any time. However, only your doctor can determine if this measure may be necessary. The Verisyse lens design has been used successfully in Europe in over 150,000 procedures. During that time, thousands of patients have had the Verisyse lens. In the United States, clinical studies of the Verisyse procedure began in 1997. During that time, more than 1,000 lenses were implanted in over 500 patients. Local anesthesia is used to numb your eye prior to the procedure. Therefore, most people experience no pain during the procedure. Although some discomfort is normal during the healing process, the vast majority of people experience little or no pain after the Verisyse procedure. If you have specific questions or concerns, discuss them with your doctor. The Verisyse lens is designed to provide permanent vision correction, as long as you don't suffer from other vision health problems, such as cataracts or other eye diseases that may affect your vision. In the event that you develop cataracts later in life, the Verisyse lens can be removed, and a lens designed to correct the cataract will replace it. Because placement of the Verisyse lens is a procedure that requires anesthesia, women who are pregnant or nursing are not candidates. Like LASIK, Verisyse is considered an elective procedure, and the costs are not covered by health insurance plans. However, financing options are usually available to help you pay for the Verisyse procedure. If you have concerns about the cost of Verisyse, discuss them with your doctor or patient counselor. The Verisyse lens is proven to provide very precise and predictable correction of moderate to severe nearsightedness while leaving your cornea, the outer focusing lens of your eye, clear and unchanged. Verisyse has been thoroughly evaluated by the United States Food and Drug Administration, or FDA, and results have been published in dozens of medical journals around the world. A study evaluated by the FDA showed that 92% of people having the Verisyse procedure were 20/40 or better, and more than half achieved 20/20 vision. This is remarkable in that 20/40 vision allows you to drive an automobile without glasses in most countries. In a recent FDA clinical trial of 412 people with moderate to very severe nearsightedness, ranging from -5.5 to -22.5 diopters, satisfaction with the Verisyse procedure was very high. 84% of people rated their quality of vision as favorable. 91% of people rated their satisfaction with the procedure as favorable. 92% said that they would recommend the Verisyse procedure to other people. In a European study of severely nearsighted people, 72.2% of highly myopic patients with Verisyse in one eye and LASIK performed on the other eye preferred Verisyse. The reason for their preference? Better quality of vision. Remember that these are very nearsighted people and that LASIK is still the preferred procedure for people with lower levels of nearsightedness.
In the mornings, get up and jump on my bike, go to the mountains, and ride the bike without a problem. Don't worry about glasses. Don't worry about my contacts flying off because I blink.
Before I had surgery, I had really bad eyesight. So I think this eye was a -8 and this eye was a -7.5, or it was one or the other. I mean, if I didn't have my glasses on or my contact lenses on, I was blind. I'd wake up in the morning, I couldn't see anything. I think what definitely bothered me about having bad eyesight, besides the fact that I had it for so long, was not being able to just see in the morning, to be able to go swimming and see, to do sports and not worry about if I was wearing my glasses that something would hit me in the face and I'd break my glasses, or if I had my contacts in that I'd rip them and then I'd have to carry around like 20,000 spare pairs, or running out, or just anything that I was doing was always worried about something that was going to affect my eyes. What really made me decide to get vision corrective surgery was I just was reaching my late 20s. I'd worn glasses since I was 5, and I thought it was now or never. I should find out whether I could have the corrective surgery or not, and at least I'd know. I like the fact actually that it was a lens and it wasn't LASIK where they're cutting away something, and that if something happened when I got older that they could take the lens out. Following the surgery, my experience was very little pain actually. There were like some painkillers and I did take those, but really there wasn't any pain hardly at all. I did have a bandage over my eye, but when I went into Dr. Maloney the next day, he took it off, and it was actually amazing because I could start to see. It was blurry, but I could definitely see, which was a lot more than I could see before. I believe that right now my vision is actually better than 2020. To me, I sometimes forget that I had the surgery, which I guess is the best part. I think what's really exciting to me about not having to wear glasses or contacts and about having had the surgery is just that there's so many things that I could do that I couldn't do before. I can go swimming and open my eyes and and be able to see, or not have wear a contact lens and have it stick to my eye, play whatever, sports or activities I want and not have to worry about, breaking my glasses or something, or Really just waking up in the morning and being able to see the alarm clock, being able to look out the window and see things, that's what's most amazing.
My vision was so bad, it's minus 20 diopters when it's read in medical terms. And if you were to just try to describe that, try to read anything, and you can only see it if it's sitting in front of your face by your nose. That's how bad it was. I couldn't even walk across any room without my glasses or contacts on, let alone watch TV. Even if it's a big screen TV, you couldn't make anything out. It's so blurry. That's how bad it was. Well, before I had my implant, it was really difficult to get around. If I was not wearing my contacts or my glasses, normal activities, everyday activities were something that I had to think about it twice before I actually got to jump in a pool. I couldn't really do it if I had my contacts on. And if I took my contacts off, then I couldn't see what I was doing. It's been a total change. Well, the day of surgery, during preparation, they talked about what they were going to be doing, that I was not going to be under total anesthesia. It was going to be local. As far as pain is concerned, maybe my tolerance about pain, it's too high. I didn't feel much pain at all. After surgery, they gave me some pills that I can take just in case there was discomfort, but I never even got to take them. The procedure was done so quickly. The way that my life has changed now is that now I got freedom to just get up and go in the mornings, do what I need to do. Don't worry about putting on my glasses and think about people looking at you funny because you have these thick glasses on your face. Now dealing with those 20 minutes in the morning to clean my contacts and put them on, and being so careful about my surroundings, atmosphere, being outside, the wind, the water, I can now just in the mornings get up and jump on my bike, go to the mountains, and ride the bike without a problem. Don't worry about glasses. Don't worry about my contacts flying off because I blinked. It took me too long to blink. Those are the things that I enjoy now. What I would tell people that are in my same situation is that I was so disappointed every single time I visited any other doctor's office because of the fact that they couldn't really do anything for me. With this new implant, it was so amazing the way that you can see now. You can read small print, large print, you can see at a distance. It gives you so much freedom to do whatever you need to do, stuff that you only thought about it before. Now it's with this new procedure, there's hope, and it can only get better. If I was at that limit and they can do this for me now, I'm sure there's people out there that can benefit a lot.
I was interested in doing LASIK, and it was actually an extremely important thing for me to do now before I ever had children, because my vision is so poor, and I didn't want to have to be a mom always trying to reach for my glasses or having my contacts in. Because I am so blind, there's no way I can really function without having my glasses or contacts. And my vision's been like that since, as far as I can remember, probably since I was about 8 years old or so. And as it turns out, I was not a candidate for LASIK. I'm one out of 1,000 people who can't have LASIK because my cornea was too thin. So that was not an option for me at all. I'm an attorney, so I naturally have to do a tremendous amount of reading every day. I'm in litigation, so I'm constantly reading cases, both online on the computer and in hard copy form. I'm reading briefs, I'm reading documents, client documents, revising documents. It's a constant battle with my eyes. This is an amazing thing for me a concept that I really can't even understand yet, where I can actually wake up, not have to wear contacts or glasses, and go to work and function like everyone else. It's really amazing. And when it was all said and done, I sat up from the table and walked out of the room feeling fine and had no pain at all during the entire day. When I immediately opened my eye, it's obviously a little blurry. But after only a few seconds, I was able to see. And before I knew it, I was reading letters off of the screen across from me and doing remarkably well in a matter of minutes after they were able to take the patch off. So I actually was able to see pretty well that day. Truly an amazing thing, and I absolutely would recommend it to anyone who is in a similar situation like I am. Because now, at least with one eye, I'm okay. You know, I can go to bed and I know that if something were to happen, I'm completely functional. And that's huge. Just from an emotional perspective, you really can't describe how amazing it is to feel good about that and to know that you can survive should something happen to your glasses or contacts.